If you're not sure why your knee hurts, you can use the location of the pain to find out what type of knee injury you may have. So let's look at the most common knee problems and their symptoms. If you have pain at the front of the knee, around or behind the kneecap, this can be patellofemoral pain syndrome, sometimes called runner's knee. And this often causes knee pain after squats, but you may also feel it when sitting with bent knees, running, jumping, taking stairs, or when kneeling. A similar but different injury is chondromalacia patella. With chondromalacia, you'll also get pain at the front of the knee, but in 90% of those that have it, the kneecap makes grinding noises when moving up and down. And there may also be swelling around the kneecap and muscle loss of the quadriceps. Knee pain below the kneecap, directly where the patellar tendon attaches to the kneecap, may be patellar tendinitis, also called jumper's knee. And this gets worse the more you load the knee, so more jumping, cutting, and other explosive movements usually cause more pain. And the crazy part about this is that you may only feel it hours and sometimes even a day after your training. If your pain isn't directly in the tendon, but more like tenderness around the tendon, it may be irritation of the infrapatellar fat pad. And this is usually a burning or aching pain, especially with full extension of the knee. You may also notice swelling, joint noises, or a snapping sensation. In children, knee pain below the kneecap where the patellar tendon attaches to the shin bone may be Osgood-Schlatter-disease. And this injury happens in children during a growth spurt, and it's most common in boys around the age of 13. In addition to the pain, there may be a bump or swelling at the top of the shin bone. Knee pain right above the kneecap can be quadriceps tendinopathy, and this pain sets in gradually over time, and it's often worse with deep knee flexion, especially under load. It's common in sports that require squatting low, such as weightlifting or beach volleyball. Knee pain on the inside of the knee can be patellar maltracking. You may feel it in the tissues that pull your kneecap towards the midline of the body. Another type of medial knee pain is medial plica syndrome. You may have clicking, popping, or snapping on the inner side of the knee, as well as occasional swelling. Sometimes you can even feel the plica snap back and forth right next to your kneecap if you bend and straighten the knee. If your pain is directly on the joint line where the shin bone and the thigh bone meet, it may be related to the meniscus. You can find that line by bending your knee and tracing the groove where the two bones meet on the inside of the knee. And with this injury, you may notice snapping, popping, or even a crunching sensation inside the knee. And you may not be able to fully bend or straighten the leg because of resistance coming from inside the joint. It can also feel like it gets stuck or gives way. If you notice pain, stiffness, as well as joint noises such as grinding or creaking coming from inside the knee, it could be osteoarthritis. In that case, the stiffness is usually worse in the morning, but it gets better throughout the day, and moving the knee in certain ways may cause pain all around the knee or just in certain places like the front or the side. Pain on the outside of the knee can be IT band syndrome. You'll feel this pain right here where the IT band crosses the knee, and it's a sharp stabbing or burning pain that can radiate up and down the leg. Running, cycling, walking down the stairs, or walking downhill make it worse. And often the pain doesn't set in immediately during a training session, but only after you've already been running or cycling for a certain mileage. And then when you stop, it can go away again quickly. Pain on the back of the knee can be distal hamstring tendinopathy. In that case, you will feel pain when bending the knee against resistance, and it will be in the hamstring tendons. It can be more towards the inner part or the outer part of the knee, depending on which tendons are injured. The pain can be delayed. You may only feel it the next day. Pain on the back of the knee can also be a popliteus strain. In that case, you will feel it right in the fold on the back of the knee, a little bit to the outer side, and pressing into that area may be painful. It will hurt when running, especially when sprinting and when walking downhill. Another cause of pain on the back of the knee is Baker's cyst. And this is a fluid-filled lump that sits on the back of the knee, and it can cause tightness or discomfort. The swelling may disappear when you bend the knee, but it worsens with activity and may stop you from fully bending or straightening the knee. Here's a chart of the different knee pain locations and all their symptoms. You can pause the video to check it out in detail. Now you have an idea what your injury could be. Please also have it checked out by a doctor. If this video helped you, subscribe to this channel and hit the like button. That's it for now, and maybe I will see you in another video, like this one right here.